Good morning. I'll call the Crow Wing County Committee of the Whole meeting for September 16th, 2025 to order. First up is Harvest Plan, Tom Strock. Welcome.
Good morning, Mr. Chair and Commissioners. Yeah, so our first item for today is our 2026 Harvest Plan. Land Services comes here every fall and starts the discussion for our Harvest Plan. The Harvest Plan is derived from our Forest Management Plan. Our Forest Management Plan is our 100-year outlook. We have a 5-year candidate stand list, and then we have our 1-year Harvest Plan. And so the Forest Plan lays out a detailed list of what we can sustainably harvest year over year, and then from that we put together that 5-year plan, which then distills into what we're going to talk about today. And so as you look at the Harvest Plan up there, our 2026 goals are 1,572 acres. And to back up a little bit, we did complete our 2025 Harvest Plan, and that was we had a plan of 1,424 acres, and we set up 1,419. So there's always a little bit of wiggle room just because we're working with large acreages, and our average sale is 30 to 40 acres. This year we're looking at about 20% of this is a thinning, and you will see that our numbers have increased a little bit, and that's because of the harvest plan that we put together, or excuse me, the forest resources plan that we put together update for in 2025, which redid our modeling. So the model looks at all the forest inventory that we have out on the land and then tells us what we can sustainably harvest based on the goals and objectives and our different treatments of the timber. And so before any timber is set up and sold, a forester goes out and does a detailed field examination. This can include setting up a sale, or it can include a deferment if our inventory isn't correct, and then they go and try to find something else to replace it. There is a map included as well on the next page that shows where we're potentially looking at going for 2026, and I will pause for any questions you may have.
So on this map, it's the yellow or the gold color where we're going to be harvesting?
That is correct, yep. And we try to space out our timber harvest, so that way we're not harvesting one large area in one specific spot. We try to scatter that throughout the county.
Questions? Looks like you're heavy over in Commissioner Lee's district, huh?
Always heavy over there. That's our egg over there is our forest. So
Just
Commissioner Corning.
I think more of a comment. I think if I recall correctly, when we had the NRAC committee, the Natural Resources Advisory Committee, we ran this by that committee too, right?
Correct, Commissioner. Yep, yes we did. Yep, so our normal process is we bring this to NRAC in July, and then we come here in September to talk about it at Committee of the Whole. And then pending conversation today, next week we'll come back with a request to set a public hearing for November. And then we'll hold that public hearing and allow the public to come and give any comment they may have.
One other question, Mr. Chairman, is so if you look down in my district, right on kind of like to the way I'm looking at it to the right of South Long Lake, is that over there on Leisure Lane, that yellow spot there? I noticed that off of Leisure Lane that you punched in like it looks like a wide road and some gates in there. Is that preparing for this, or what's the reasoning for that?
Yep, so that was a harvest we conducted this summer. So that would have been on our harvest plan for 2023 or 2024. That timber sale is finished. After that timber sale, we did make some improvements to the small parking lot there, put in some new gates, and then did some work on the ski trails, and so that is finished.
Okay.
Yep.
And then, so where is this at, this yellow, big, large yellow spot there? Is that kind of to the east of that?
That would be to the east and south just a little bit. I'd have to look in more detail to give you exact specifics. I know this one is a final harvest, kind of in some swampland, so it won't be visible from the road.
Okay. That's all I've got.
And to understand, when you sell these, they have 3 years. Is it 3 years to harvest?
Yep, so our summer permits are 2 years, and then the logger can buy a 1-year extension, and then our winter timber sales are 3 years with a
Okay.
1-year extension. And we allow that extra time for winter timber sales just because of the fluctuations we get in the weather. So if we don't get a nice cold winter, they can't access that winter wood, and so we just give them an extra year to get it done.
Okay.
One question, Mr. Chair. On these harvest plans, how many of these are thinning versus how many are the final harvest where, the thinning, you did a thinning up there in Ideal, last year before, whatever, and you don't even know now that it's been thinned. I mean, you see the trees growing, and that's what we want to do. How many of these areas are going to be, where you just level it? And that's where I get calls, from somebody, and especially up in my area, there was a school trust land that got really leveled up there by 39 and 103 or whatever it was, and I got many calls on that, and I told them to call the DNR and talk to the forester in regards to that. So do you have a specific which areas could you show me in my district, which areas are actually, the full
Yeah.
clearing?
Yep, so we have about 20% of this harvest plan is a thinning.
Okay.
The rest is a final harvest. And those final harvests will vary from harvest to harvest, exactly what they look like. Here in the county, we've got a lot of variety, in our tree species, and so it's very helpful for us that, we have the oak and provides nice reserve trees for people to look at and wildlife to use. But I can certainly get you a map of which areas are thinnings versus which ones are final harvests, if you'd so choose, if you'd like that.
And we're going out there and replanting those areas, correct?
Yep, so a lot of our sites naturally regenerate, so our hardwoods will either sucker from the stump, they'll sprout from the roots, or like an oak tree will rain out acorns and then they'll grow. So most of our stands actually regenerate naturally. We do plant conifers on sites that need to be planted.
Okay, thank you.
Mr. Chair, one question.
Really?
This is on the county website, correct?
Yep, so we post the actual acres of the harvest plan, and then on the interactive map that we have, we actually show these polygons as well, so people can get out and take a look and see where we're going, what we're doing. We also notify adjacent landowners when we set up a timber sale. We'll send them a letter with a map saying, hey, we've established a management line between the county land and your property. Let us know if you have any questions, comments, concerns, if you know of any, natural heritage features, archaeological features, so we can properly protect them. So that way we're trying to be good neighbors.
Yeah, perfect, thank you.
So we need to set a public hearing for, you said November?
Yep, and that'll be on the agenda for next week.
Okay.
Listed on consent, or do you want it as a regular agenda item?
Consent is fine with me.
Consent is fine.
Okay.
Yep.
So the agenda item will be to set the public hearing for November, 25th? For November 25th. Okay? All right.
All right, thank you very much.
Thank you. Have a good day.
Kara Terry.
Give me 1 second to get my ducks in a row.
You brought ducks in?
Thank you. Brought reinforcements in case we're here for a while and my computer wants to die, so. I'll also share my screen, is that okay? Oops.
Mr. Chair,
Commissioner Coyle.
I'd just let you know that Renee and I color coordinated this morning before the meeting.
You're always playing to the media, aren't you?
Of course.
Remember that, Renee.
All right. Mr. Chair, County Board members, Kara Terry, Crow Wing County Community Services. I'm here today with my team, and we'll introduce them as we move through the presentation. And it's not moving. There we go. So a bit about our agenda. I'm just going to give a brief overview. April's going to talk about funding sources and then her finance and accounting team. Gina will then talk about public health and long-term care. Tammy's got the adult services portion of today's events. Jeff is here to talk about fraud collections, support, and technology. And then Griffin will address children and family services, and Krista is on community corrections. So here's our team in an itty-bitty nutshell of all the people that I just mentioned. Community Services has approximately 210 full-time equivalents. You can see each area, the number of full-time equivalents in each division. So Commissioner Lee, you had asked for caseload sizes and things like that for our individual teams. And we are going to do our best to describe caseloads per employee, but it'll probably be more like per division when it all shakes out. Excuse me. So key areas that we focus on, and I hope you hear throughout the course of this presentation, is fiscal responsibility. So our team takes fiscal responsibility very seriously. It requires demands from the citizens for essential services, as well as needing to avoid unsustainable debt and or duplication of services. In community services, we prioritize efficient spending. We work to reduce waste, and we want to utilize public funds and make sure they're directed toward programs that provide the greatest benefit to our community. Equally important to us, but not listed up here, is transparency. So our citizens will know how their tax dollars are being spent. We conduct both independent and internal audits to help the public know that we're utilizing tax dollars effectively. Ultimately, for us, fiscal responsibility isn't about cutting spending at all costs, but it's about making wise financial decisions that balance fairness, accountability, and sustainability. All areas I know in Crow Wing County are fiscally responsible, and we appreciate your vision to invest in the future, which is what you have helped us do in regard to our prevention work, and our staff appreciate that very much. The next one is demonstrated results, otherwise known as proven results. So we focus on programs that actually deliver our intended goals. We go beyond making promises, but we actually show measurable outcomes. We have clear goals and benchmarks. We have performance metrics and data. We evaluate and hold staff accountable. And then we also look to demonstrated impacts so that the evidence that the program is making a difference. One example in this area is around our comprehensive reentry work in the jail and our law enforcement liaisons. We know the work they're doing has reduced recidivism in the jail and connected people with needed services. You've seen the data on this program, and you've heard from our local law enforcement as well as our sheriff's office about the positive impact the staff have made on folks in this county. Then there is the category of considered risk. So considered risk for us is that we, as public leaders, deliberately accept a potential downside to achieve a larger public benefit. But we do this through carefully weighing the evidence, looking at the costs, and also safeguards. It's really the opposite of reckless spending or inaction. It's really a calculated choice, and we do that on a number of fronts. So one example is our public nuisance team that works closely with Land Services and the County Attorney's Office. We were afraid that if you build it, they will come. And while we did see an increase in our caseloads, we were able to develop a process that really managed that work well. And we're doing a much better job related to that. Resource management and staff engagement, they're kind of the same thing. So resources are all about the people we have, the money, the infrastructure, and the natural resources that we utilize. Part of that is financial responsibility, as we talked about. Also human resources management, so we want to make sure we provide training and development for our staff, and performance management, so that's setting clear goals and evaluating progress, and then rewarding effectiveness. We process manage and manage our time, so we want to make sure we're streamlining procedures and delivering programs on a schedule and within budget. And then accountability, we hold our staff and ourselves to a high level of accountability, and we hope that that builds then on public trust. And then in terms of the staff engagement, we want staff to understand how their work contributes to the overall organizational mission and vision, as well as communicate effectively and help develop and grow our staff. So we're proud of the work that we do in community services. We've been asked to share in the past innovative programs and services at the state and national level. We've worked to influence our legislators to improve funding and reduce regulation. And we've worked hard to ensure the public programs we provide are top-notch. Our people don't have a choice in which to access the services we provide, so we should be giving all consumers in Crow Wing County 110% service regardless of the program. And now, April, you want to walk us through our funding sources. So maybe mention the 4 types of funding sources first, and then we'll pull that one up.
Yes, so we have federal, state, there's also some local funding, grants, and the levy in the next slide. So you can see the biggest piece of the donut here is the levy, followed by state funding. So the state funding includes various grants, reimbursement for case management, the crisis response, and AMHI are the larger pieces of that state funding. Next is federal funding. The largest pieces of the federal funding are related to Medicaid or medical assistance, SNAP, and TANF. Next is charges for services. So this includes various targeted case management, claiming for, through various health plans, MSHO, and as well as also public health claiming through health plans such as child and teen checkups and maternal and child health, okay, MCH. And then finally, recoveries and miscellaneous. So this is things like estate recoveries for medical assistance, and recoveries for various other programs, and also fees that we charge to clients.
Before you go any farther, oh, sorry.
Go ahead. No, go ahead, Commissioner Lee.
Do you guys keep, or have you kept track of previous years, the percentage breakdown of state and federal versus levy? Those, I'm sure those percentages are changing. Have you kept track of that at all?
We could provide that to you, yes.
That would be wonderful, thank you.
And to Commissioner Lee's point, this graph will change significantly in the coming years. We already know the SNAP program is going to change significantly, so that federal piece of the pie is going to become smaller, and the county's portion will become larger. And that's only the first program we're seeing. So I see NACO as the National Counties Association is going to do an update on what they're seeing coming down the pipe in 26, 27, and 28. So they're doing a review of that in the next week or so. So it'll be interesting to hear from them on the impacts that they think will happen to county government. So thank you.
Okay, here are just a few of the responsibilities of my team. So as the business manager, I manage the accounting team.
Before you move on, can I ask
Sure.
a question? So
Sure.
can you back up to that round slide that you had?
This one?
Yes. So 9.5 million, why is it not showing up on here?
Push projector instead of broadcast.
Okay. So 9.5 million, I would assume that, so this whole circle, that's all the programs and everything all together, the money that goes out, right?
Correct.
Okay. Benefits and everything. So of the I would assume that the $9.5 million, none of that goes out in program aid. That's more for staff. Correct?
It's both. So some of it is directly related to clients, some of it is staff, and some of it is also, like, under the state, for example, would be the Adult Mental Health Initiative, which Tammy will be speaking to a little bit later.
But if somebody's getting benefits, the levy dollars aren't paying for those benefits. They're more paying for staff. Am I right or wrong?
Yes, but those state and federal dollars are also paying for staff. There's
No, I know it, but I'm just talking about just the levy dollars that's not paying for any, you know, if somebody needs $400 for gas for
Our
their
levy
car.
dollars don't go to pay for the benefits. Our levy dollars would go to pay for the support staff to administer those benefits. The levy dollars, the 12.5 that you see, are separate from the 9.4. The 9.4 includes staff costs as well as direct benefit costs to
Right.
citizens.
The green part is levy, isn't it?
No, the
Oh.
dark blue is levy. The
Okay.
green is federal
All right.
reimbursement
Sorry
dollars.
about that. I was wrong on that. But that answers my question. None of that blue is being,
None of the blue, none of the
It's just
12.5.
staff, pretty
That's
much.
just staff or programmatic costs from the standpoint of supplies, materials, that kind of thing.
Okay.
Not paid out to citizens.
okay, thanks.
Okay, so the accounting team, I did have 6 accounting people, but we reduced that to 5, so that was part of the budget process for 2026. And we were able to do that. One of the reasons we were able to do that is we worked with IT to create some efficiencies. So with that accounts receivable, accounts payable, we process approximately 1,100 invoices each month, and many of those are also claimed for reimbursement for federal and/or state reimbursement. So we implemented with IT some it's called batch claiming and batch invoicing, that just creating efficiencies. And we also transitioned childcare approvals to another team that just made more sense for that to move to the family team in income maintenance, and other efficiencies in how we pull the data, really utilizing Excel and our financial system. My team also manages over 60 grants. We track all of those grants for staff to ensure we are spending within the grant, and also one other thing I was going to mention. Basically, we are making sure that we are receiving reimbursement for anything that is eligible for reimbursement, whether that be a grant, payments to clients, anything that can be reimbursed. We are ensuring that we receive that reimbursement and tracking that.
So April's team is instrumental in making sure our revenues and our expenditures align. She keeps us on track.
So there's 2 components, and correct me if I'm wrong. There's one is about following the dollars and making sure we get back what we bill them for, but also then the reporting part, where the final, once it closes out or whatever, you have to report to the feds or the state, whomever. So there's quite a bit that goes into that. It sounds simple here, but some of that's got quite a few pages of reporting that go with it, but you're always trying to follow those numbers too, to make sure there's compliance with the grant requirements.
Yeah, absolutely.
So I don't want that to be minimized, that there's a lot of work for personnel to do in tracking those grants and that.
Any other questions? Okay.
I don't think I had a question in there, I think I had a statement.
You did? Okay. So now we'll move into public health. We're going to do some toggling, or Gina is, between this and our data system, our Power BI. So hope it works. I do. But first, let's do this.
Okay, I'm Gina Heyer. I'm the Public Health Manager here in Crow Wing County. Good morning. And I'm going to talk to you a little bit about the different programs.
There's some of them. I have
This is
another
just some-
page.
Oh, yeah. This is just some of what we manage in public health. Our public health department consists of 14 individuals, including a supervisor, Bethany. And with those 14 staff, we manage more than 14 different grants. All of those grants have different timeframes, different responsibilities, mandates, and reporting that goes to the state. We work with MDH primarily for the core public health grants, so what you see up there on the screen. And I'm happy to read through them if you'd like. or you can just ask me questions if you see something up there and you don't know what that is. I'm happy to help explain. Most of these are focused around maternal child health, women, infants, and children. We also do a lot with public health emergency preparedness. The local public health grant helps us with things like the public nuisances and disease outbreak mitigations, such as with COVID. And then SHIP is our statewide health improvement partnership. I believe you're familiar with Kelly Johnson. She manages most of that program. And we also work very closely with Growing Energize. They help us complete our CHA and CHIP every year, which is our community health assessment and our community health improvement process. So there's a lot that goes into public health.
What's the follow-up program,
Follow along program?
or follow-along program?
That's a new one, actually, that we just started, or got the funding for recently, and it actually integrates really nicely with our maternal child health family home visiting program. Follow along program, we're completing what are called developmental assessments. They're ages and stages questionnaires. So we're working with the kids that are in WIC and our case management programs, and completing developmental assessments for them. What that helps with is we get kids into care and to follow up with their doctor earlier and make sure they're being seen for anything that might pop up developmentally.
Question, can you
Gordon.
toggle back to that list?
I'm gonna try.
Sorry.
Good job.
So something that just popped out at me is cannabis and substance use. You know, all I ever hear on the news is cannabis. You know, now the governor signed some kind of a deal with the tribes, and they're going to have cannabis stores. What happens when everybody's dumbed down on gummies or cannabis? What's that going to look like? I mean, are you going to, when it's all legal?
Well,
Yeah, I don't know. I just seems kind of, here we're spending money for prevention, but yet we're just opening it up just wide open. It's just kind of crazy.
agreed. And what we have done here in Crow Wing County is we've been able to focus our cannabis funding on a specific population, and who we're focusing on right now for the cannabis portion and substance use portion are our pregnant and parenting moms. So reducing use during pregnancy and the prenatal period to help them achieve a healthy birth outcome. And that was the focus. I think we're pretty original in Crow Wing County, as usual, where we're doing something a little different than the rest of the state and focusing this. We brought in a public health nurse, Brianna, and she's running that program and doing a wonderful job coordinating with the local hospitals and prenatal clinics to make sure we get those moms seen by our nurses here.
Okay.
And then we also have her working closely with Blade and our work on that side as well.
So when you're working with pregnant mothers, it's more of an educational thing of the safety of the child, of this or smoking or whatever they're doing?
Yes,
Okay.
it says
Oh, okay.
cannabis, but we touch on all
Everything.
forms of substances with
Okay.
moms when we're discussing education.
Perfect. Thank you.
Thank you.
Thank you.
All right, let's try this again.
Mr. Chair, just to bring up a point, when the state was looking at putting in the cannabis, making it legal, they were looking at the 10% tax, and they were until last year, until the special session, they had looked at taking part of that tax and giving it out to counties and to cities to help fund some of this stuff for the cannabis. When they passed it, they actually raised the tax to 15%, and decided the state needed to keep all that money themselves, and none of it coming out to the cities and the counties to help with it. And that was something that, as I was involved before with League of Minnesota Cities, when it was first coming down with gummies, that was a big push, that, some of that money will be coming back in order to help with that. And at the last minute, the legislature, in their great wisdom, decided we need to raise the tax to 15%, and we keep it all for ourselves because we have a budget problem here. So just to make that point, I don't think that was a question either, but it was a frustration I have.
One thing you got to always remember is, because I can remember when I was like 18, I was working for a plumber And there was two things that you had to learn when you're a plumber. Payday was on Friday, and you know what runs downhill. And that's kind of the same thing in politics. It's the federal government, state, and then it kind of trickles on down to us, and we got to try to figure out all the problems here. So.
Okay, as mentioned, we have 14 staff in public health. Although that staff does a marvelous job, we do need more manpower, as I know you're aware, that because I did request a staff earlier this year for public health for 2026. And here's why I'm talking about this right now, is I'm showing you the public health temps. We've had temp staff working in public health for actually almost 7 years. I know you wanted to see the last 3 years and what that looked like. We've had over 7 staff in the last 7 years working as temp staff with the WIC department. And because of that, this is just showing you the public health temps, what we've spent on temp staff. Currently, we have 1 full-time temp who is clerical, and the other one is a public health nurse working with us, and they do a wonderful job. Why I'm showing you this too is to show you that if you look at the top right corner, 2023, you can look at the health time study participants for overtime. You can see we're also paying out for overtime for staff we currently have on, just to keep these programs going. You can see it has bounced back and forth, 23, 24, and 25. We're looking a little higher this month. We've had a lot of coverage to do for leaves and such within the public health unit. I'm prefacing this as we go forward, just when I can show you the numbers then, hopefully you can keep this in mind. Let's see.
Mr. Chair?
Go ahead, Commissioner Lee.
Sure.
Of those 14 that you're talking about, or excuse me, those 7 temps that you're talking
Yeah.
about, are those included in that 14?
No,
or
they are
above
not.
and beyond? Okay.
They are not full-time. We aren't counting them as our FTEs. They are temp staff.
Okay. So then the one that you're asking for then, is that replacing any of those temps?
It will, yes.
Okay.
Yes, and that is the goal, because when you look at temp staff, we invest a lot of time into training these staff. I have the numbers here in front of me as far as hours and what it takes to train in. A temp for WIC, if you're interested. I can just tell you, for instance, okay, so we have a new public health nurse who is going to be working WIC. It starts with a 7-day MDH training, 2 weeks of shadowing in WIC, and 16+ hours of paperwork, computer system learning, et cetera. So that's just for the temp. We're looking at least a month's worth of training before we can get them up and working in the program, which is what we want. In addition to them, we're having to pay one of our staff to be outside of the clinic and training them. So this, in my mind, it's a waste of resources to do it that way. It's much better to hire someone on full-time who we can expect to keep. Temps don't always stay because of the fact that they don't have benefits. And there's not a long-term investment then with the county to stay on as an employee. A lot of them want to, but if we can't provide that soon enough, they're gonna go somewhere where they can get that. We've trained them, we've given them all the resources, they can go work for Beltrami County, Cass County, somewhere else, and get a full-time position. So I just wanted to put that out there. And so that gives you kind of the numbers of that. Again, this just, up here on the board, this is showing you the different programs we work with public health. I don't know why my dollar amounts aren't showing, but they aren't, so that's a bummer. But it's just the circle of different pots of money that we have to work with. It just gives you an idea. Each one of those pots has different responsibilities and reporting we have to do to the state, all on different timeframes, and they change every year. So I just wanted to give you a visual of that.
What's the difference between the green and the blue in the?
The blue is, let me remember, state, and then green was federal.
Okay.
And MCH is a little bit of, the purple one is a little bit of state and federal funding. Okay, get off, let's go off this one. Now I'm gonna talk about numbers a little bit.
Before you go on,
Yeah.
go back to that previous screen. So
Go back to the,
you have 142,000 something for 2025, only through the end of July.
yes,
Significantly more than 24 and
Yes.
way more than 23.
I'm happy to tell you why.
I would appreciate
Okay,
it.
so recently we have received 3 different pots of funding. We received the Foundations of Public Health funding, which is a reoccurring grant, annual grant. We'll get that every year. Maybe it'll be a little bit different amount, but in 2025, we received the Foundations of Public Health grant, and that was for $185,338 for the year. I have a public health temp, working in that area full-time and managing a lot of that programming. Because again, that's another pot of money that has specific programming. Part of what we're doing with that is our Brainerd for All Ages working to promote a more age-friendly community, working with the city of Brainerd and numerous other.
So under that grant, does that pay for that position?
It does, and
It
the
does,
fabulous thing
okay.
about public health is it does not rely on levy funding. These are all grant-funded positions.
Okay.
All of them that I have brought up, even the temp positions are 100% grant-funded, yes.
So the full-time position you're looking for would be grant-funded then?
Correct.
Not levy-funded?
Correct.
Okay.
So that was one of the grants. The infant health grant was another one that came in within the last 2 years, and that's $151,000. The cannabis was a grant that came in within the last 2 years, and that's $112,000. We were able to hire a full-time PHN, as I mentioned, for that position. Follow Along was another new one. So that's kind of the new things that came into public health recently without us really building capacity with full-time equivalent Crow Wing County staff.
So Gina, a question, of all those grants that you just cited, as a county, are we required to do that, or we're not required to do that? I think the grants are there, and then we can apply for them, right?
That's correct in a way, but not 100% correct. It is the responsibility of local public health to provide maternal child health services in the community. WIC is one of those services. Family case management is one of those services. Public Health Emergency Preparedness and Response Sustainability Grant, those are also responsibilities of local public health. So if you take the local public health grant, you have to fill these buckets with something, and these are what we fill them with, were the buckets that were up there.
So what if we didn't take the grant? What if we just said we weren't going to take the grant and we weren't going to do that work?
Someone else, if we didn't take WIC, someone else in the community, we'd have to find someone else to take that, or we'd have to find another way to fulfill that duty as local public health government in Crow Wing County.
So the requirement for local public health is to ensure that those services are being provided either by county resources through accepting the grant to do that work, or coordinating with another agency or some other entity within the community.
Correct. And
It does. I just want to make, it's not a question, it's just a comment. After I served there for 2 terms, and I was on Health and Human Services for the whole time I was there, I kind of know how it works. What happens is every 2 years and every 4 years for the Senate, you get brand-new legislators there, and what do brand-new legislators want to do? They want to introduce a bill, they want to put their mark on the legislature or on the state or whatever have you, and they dream up all kinds of new programs. And this is the way the federal government and the state government get you to, they offer up this grant, and then the grant may be ongoing, but then when the legislature or whatever, they get in a crunch, sometimes those grants go away. I think back to the President Clinton days, he wanted 100,000 new cops, and I can remember Brainerd, I think, hired 2 or 3, and they were fully funded. But then when they went away, they had to make a tough decision to continue to fund those. And so this is how government keeps growing, is because you go, oh, there's a grant for this, and there's a grant for that, and you go after every single grant, and then you hire more staff, and government just keeps getting bigger and bigger and bigger. And I would caution that running after every single grant, and and just trying to figure out how much of the levy dollars are paying for staff. of the 12,525,000, I come up with an average of if you got 210 people, that's like $60,000. So if everybody's making an average of $100,000, or 60% of the money to pay for the staff over there is coming out of property taxes. You know, and then I just know that there's a lot of people that struggle to pay their property taxes. So anyway, that was just a comment. I just think we need to really be careful about running after every single grant.
And just so you know, Commissioners,
That makes any sense.
we don't run after these grants. These are grants that are allocated by MDH to us. And so many times we are given unfunded mandates. In this case, they have been funding some of the newer programs, but we have not applied for these grants. If we don't take them, they will go back to MDH or the state, or we would have to figure out how to do the work they're telling us to do without the funding, which doesn't make good fiscal sense either. So I hear what you're saying in terms of chasing grants, and I completely agree with you. And these ones we're not chasing. They are legislating them to us, so.
Question for you, Gina. So if we have to provide it, so say WIC, but we don't want to do it, so we find another vendor, what's the liability to the county
It would still be our.
for their performance? So
Yeah.
we still have a responsibility, even if we find another entity to run it.
Correct.
Just want to be clear
Commissioner
on that.
Franzine can speak to how hard we tried to find another provider and the difficulty in doing so, and we were unable to secure a solid provider to do that. So we've tried in the past, just like with fingerprinting, we've tried to find other providers in the community and haven't been successful.
But if they don't run it ethically, the liability is still the county's.
Correct, yes.
Just want to be clear.
How about the licensing? Is Sourcewell still handling the licensing for?
Yep.
Oh, okay.
Yep, for childcare and adult foster care licensing. Mhm. And I can have them come present at any time you guys want to hear more about the work that they're doing, if you'd like to know more about that.
Just explain that to me a little bit. That's the first I've heard that. Sourcewell licenses are public health?
Not our public health, but they do for our childcare providers. The local-based, not the center-based. DHS does the center-based, or DCYF does the center-based childcare. But they license our local childcare providers as well as our adult foster care homes.
Okay.
So we pay
Why-
a person.
Maybe Commissioner Barrows, can you answer that? Why is Sourcewell
So
a
the-
licensing agency?
I think, correct me if I'm wrong, but the counties didn't think they had a full-time position, so Sourcewell stepped in and said, we can do this for the
okay.
entire five-county region.
Correct.
Now I remember. Okay, continue on,
Yeah.
sorry.
Okay. Public health nuisance?
Okay, we'll flip back. This is looking at public health nuisances. We've really made improvements with this, done some continuous improvement work surrounding these efforts. And I'm just going to say that this week I've got Bethany, our public health supervisor, and Taylor, our public health nuisance worker, are going to LPHA and presenting on what we've done in Crow Wing County regarding nuisances and the process and the continuous improvement. They're presenting to the state. So they've done fabulous things with this program and deserve a lot of credit for that, for sure. Looking at our numbers alone, like you said, we thought possibly there would be an onslaught of a lot more. We have seen an increase in those that are reported, and in some ways, it's great. We're cleaning up the county. We're looking at 78, back in 2023, we responded to 78 cases, 24 was 77, and so far now, this was through August, we have had 58 public health nuisance cases. You don't see them all in front of the board here. A lot of them we're able to resolve with the individual, and also working with land services and the county attorney.
Whoops.
That's okay.
Sorry about that.
Any
Gina, what's the
questions?
difference between a site visit and a public health nuisance case?
The case alone is when we get a report. So we could get a report from any of you, we could get a report from a concerned citizen about tires in a yard, numerous different things. And so those are the number of reports or cases that are coming through. And the site visits is if Taylor actually has to go out there and look at the site, drive to the site, and it might be, I'm sure you've heard with the cases that we brought in front of you, 3, 4, 10 times that they end up going out there to clean up a site. So that's the site visit process. If they're duplicative, they're not added in here more than once, so hopefully that makes sense.
So of the 94 cases, of the 94 site visits, only 58 of them have resulted in a public health nuisance.
Correct. Sorry.
And you guys determine whether or not it's a public health nuisance?
Yes.
I mean, if it's, I don't know, I can't,
Yep,
yeah.
sewage.
But sometimes you look at it and you go, I don't know if this is a public health nuisance. Okay,
Sometimes it's as simple as someone put their garbage outside of the bag and outside of the garbage container, and it's
Right.
been sitting there for a week, and a neighbor will call.
okay,
We call the person, put the garbage in the can,
Okay.
done. So, things like that can be resolved fairly quickly.
Do those neighbors get along?
Always.
Always.
Okay, so that's our nuisances, and then I'm gonna move on to, unless you have questions on nuisance.
so if somebody's throwing their garbage in a pile and thinking they're gonna burn it in the spring, that's no.
That's a no-no,
Yeah.
yep.
That just recently happened, and that guy happened to stop by my place, and I told him, I said, that was me. He says, I think my neighbor turned me, and I said, no, that was me. So I probably lost his vote, but I'm cleaning up the neighborhood.
Good.
Okay. We talked about family home visiting, and we talked about WIC. Most of our clients that are in the WIC program also receive a public health nurse who comes out to their house and does what's called family home visiting cases. I know, Commissioner Lee, you were interested in the numbers and the cases, so this shows you how many family case management cases we are working with. So the top number there, 129, is what we had in 2023. 2024 was 85 cases, and 2025, so far through August, we have 97. I want to preface this too, I should have done this earlier. When we're looking at numbers for any cases, WIC, family case management, social services, we have to relate back to COVID, basically. So when we're diving into these graphs, it's important to preface that with the context from COVID pandemic. Between 2020 and 2023, the federal public health emergency allowed continuous enrollment in Medicaid. So people were staying on Medicaid. They were not being removed, even if they did not meet eligibility anymore. So we saw what we saw happen was the cases, we had cases kind of spike there for a while, and then obviously when they had to provide the proof of enrollment to financial services, we saw a strong decline there. The decline took a while. There's a lot of paperwork involved with that. So you don't see just as soon as they ended the public health emergency, you don't see a strong decline. It took a while to process that paperwork. So I want to preface this with that. And if you want the numbers prior to 2023, like I have up here, I can provide those to you. That's no problem. But you will see that it went up and then it came down a little bit, as you can see here in 24 when people came off, and now we're going back up again. So.
Gina, so of these numbers, these mothers, the only ones that you would be working with is if they were receiving benefits from
Correct.
county. There's other mothers that are not receiving benefits, but they're not participating in the WIC program, and they're not required to.
Correct.
Okay.
Any other questions on the case
Yeah,
manager?
just to follow up on that, so what precipitates the fact that you would have a family home visit? Is there already in some type of program?
So we are alerted then, if they're eligible for Medicaid, they're adjunctly eligible for WIC and case management services.
Okay.
So that eligibility is based on the Medicaid piece, yes.
So that's, otherwise, you just don't go out and family home visit?
We do not.
Okay.
No. We have nurses here, they're nurses, they have big hearts. If we have somebody in the community call and needs help, we're going to help.
Okay,
But no, not in this way where we're funded.
okay,
Okay.
thank you.
And we're going to look at WIC next. As I said earlier, oh, you're good.
Keep going.
Oh, it looks good up there. Okay, WIC average participant count, again, we're looking at 2023, when we were still coming off the pandemic there. 1,275 people, moms, babies, children in Crow Wing County are on the WIC program, and then you see it dip a little bit in '24, and now we're headed back up again in '25 with 1,178, and that's to date. We could see that grow a little bit more, not exponentially, but it's just based on the number of babies that are born and women who get pregnant, who are Medicaid eligible. Questions?
No questions on that one. Look at that, we're toggling experts now, I probably jinxed it.
Oh, I have more to talk about. Long-term care, our over 65 population who receive elder waiver, alternative care, or are covered by Blue Cross Blue Shield, UCare, or Medica care coordination. We follow those people. With our 10 now, we have 10 social workers and a supervisor who work in that program, which is the long-term care unit. Each of those, I don't know if I have numbers. Yeah, let's go to numbers.
And will you just mention the worker that you transferred from this
Yeah.
team?
We did, due to the need in community services, we did transfer a long-term care worker this year from the long-term care team to the Min Choices team, where they were struggling. So now we are down, we had 11, now as of mid-year here, we're down to 10. These, what you can see on the screen up there, are our average caseload sizes for the year. So at any given time in 2023, we had 648 clients that we were serving in the community who were over the age of 65. And then you can see then it dropped down, just like I said it would, due to the COVID pandemic, and it dropped down to 583 in '24, and now we're up to 582 so far.
28.
528, sorry, in 2025. That number will probably go up a bit more because that is through August, I believe. Yep. So that's the numbers that we serve. Each of our care coordinators that work in that unit, their caseload sizes differ depending on the need of the client. So the specific kind of managed care enrollment that they have determines how often they are seen, therefore how many they can carry on their caseload. I believe my averages were running about, I'll write down, 60 cases per care coordinator for the long-term care cases. And
What's the youngest baby boomer?
youngest baby boomer,
Yep, in that group, what's the youngest?
you making me do math?
64?
I think it's me, 60 years old.
So 60?
pretty
65
sure.
is who we work with, so
Right, so
they would have had to been,
looking at is the trend as we go, so
Oh,
we're the biggest
gotcha.
group in the
Yes.
world. No, we're the biggest group in the US.
we are.
So that will tend to diminish, though, as we kind of a bell curve kind of approach. So,
You're absolutely correct. We don't see that diminishing until closer to 2075. We see us still continuing to rise, especially in Crow Wing County here. We're one of the top 5 rural counties in Minnesota for growth for the senior population. We've got a lot of assisted livings, nursing facilities. What a great place to retire. People are coming here for that stage of their life. So we're seeing that population grow. So although right now we are able to manage the caseloads that we have, we will see growth in this area and the need for further support as far as care coordinators go to cover the cases that we're assigned.
that's kind of where I was going. For the coming
Yeah.
years, at least, it's going to still be growing.
It's still going to grow. Let's see, I had the anticipated amount. We're supposed to grow by 18,000 more by 2055. So 18,000 more residents over the age of 65 in Crow Wing County. And
Will
it's
there be
going to,
anybody under 65 at that point? Well, a few.
Mr.
Okay.
Chair?
So-
One question. Oh, go ahead.
Billy?
No, go you first. Go ahead.
Okay, so on this is 528 cases. That isn't, you said each staff person has got an average of about 60, right?
yep.
Is that what I, so how many people are in this department? I guess I don't know what else to call it.
I've got 10 people in
10
that
people.
department, including the supervisor there.
And the 528 people, it's kind of like the same thing with WIC. These people, there's a lot of seniors that they might have a great pension and they don't need any help. But these are people that might only have Social Security and they need some supplemental help. And that's what this is?
You got it. Yep.
Okay.
They have to be Medicaid, Medicare eligible to be on this program.
Okay.
We serve the majority in Crow Wing County. Essentia Health does serve a few who doctor at Essentia. That is their caveat. They obviously would need to doctor there.
So how much staff work would there really need to be with these? It doesn't seem, in my mind, it doesn't seem like it would be that much, you know, when you get them set up with some, the benefits, and then are they required to check in or do an assessment or something?
Yes, and I would welcome you to come on a home visit. I can think of a couple of people that would like to take you with and kind of see what they actually do.
Okay.
There is obviously paperwork prior to them coming through. They have to get the Min Choices assessment, which we
Okay.
work with the Min Choices team to coordinate those efforts and get that done. And then when they do get on a health plan, the health plan has certain requirements for us. So we're paid through the health plans, Blue Cross, UCare, Medica, for the services that we provide to these clients. We are reimbursed. We're either reimbursed by a monthly amount for them being on the program, or we're reimbursed for the times that we're actually going out to see them and what we document. So
Okay.
that's the basics of it. There is a lot involved. I was lucky enough to work in that program for the first 8 years I was here at Crow Wing County, and a lot of these clients are needing assisted living or nursing facility level care. They've got a lot going on in their lives. These are very heavy clients, heavy issues. They need help getting on Medicare or Medicaid. They need help with that process. They need help understanding what services are then available for them. We help provide them with home care services if that is needed. Our whole hope is that they can remain healthy and safe in their home as long as possible. But if they do choose, or they do have the need to go into assisted living, we have to help them with that transition. That transition is not easy. I know I have a care coordinator that assisted a commissioner with that in the past, and he got to see what that entails. And I do ask of you, if you would like to see the whole process, please let us do that.
So just a couple more questions on this. So like, let's say out of the 528 people, somebody has their house, but they're only getting Social Security, so they're getting some benefits. And so then I'm assuming that there's every year you have to quantify, that's Deb's favorite word. Their income, right? Because if they had Aunt Jenny, who was 100 years old, died and left them some money, they'd have to spend that down.
You're correct.
Or otherwise they wouldn't be eligible, correct?
Yes, and they have to look into their eligibility, and that's through our financial unit over in Crow Wing County Community Services, and my social workers work very closely with them because that process is not easy.
Yeah.
It's difficult for me to understand, it's difficult for anyone to understand. So when we get the social worker out there to help them connect the dots, it's a huge benefit to the community, especially to some of our elderly who don't have a daughter, a son, someone to assist them with that process.
And then also of this 528 and a half people, I don't know how it could be a half a person, but
I should have rounded up.
average. So then if their house has not been signed over to their kids 7 years prior, then the county gets a hook into that too, also, correct? Is that what the social worker does to help with that
Well,
also, or?
That process is more something that Jeff could speak to.
Oh, okay.
He does more of that. We do the social work piece, working with them.
Okay.
We discuss them, we connect them with the financial unit, but yes, you are correct with that. I know they can allocate, don't quote me on the amounts, they can allocate certain amounts if they have a spouse in the home,
Yeah.
where the the spouse can then remain in the home. So there's a lot that goes into that, but yeah.
For program reassessments or eligibility determinations and redeterminations, are the requirements or the factors the same for every program?
No.
So if someone is receiving multiple programs, there may be that redetermination that's occurring or that reassessment that's occurring once a year, every other year, 3 times a year, whatever it might be. For one person might have 4 redeterminations that are being done,
Correct.
and not all of them through public health.
Correct. And the redeterminations don't stop there. They stop with what the person needs. When they're in a facility, grandma's in the facility, she falls and breaks her hip, obviously, that's going to change the amount of care she needs. Our case manager then has to go out there, assess what care she will need, work with the facility and the client to determine the amount that the facility will be then reimbursed for the services that they are providing. And that can happen a couple times a year, maybe just 1 time a year for some people.
So it's possible that the 528 and a half average cases that are being dealt with your team are also being touched by Jeff's team, are also being touched by Tammy's team. Multiple agencies, multiple divisions might be working with this one person to be able to get them their full need of continuum of care.
And the social workers can't do the financial work pieces. Right.
So then, like if somebody else is touching it, then do they count that as their caseload and saying, my God, look at me, I have 300 cases, and then Gina's that's part of her case too. Can she call that her case, or is it, you know what I'm saying?
Yeah, they have to, because the social worker would be working on the assessments on the social work side, and the social worker cannot do financial work. We can't have a social worker be a financial worker without actually having that title to be able to work in the systems because of rules. And so the financial worker, who has their own designation, set of rules, system access, are the ones that process then the financial work eligibility side of that same person. So, yep.
Yeah, so Grandma Jones in her home, the continuum of care of services that she receives, she might be a case count for multiple areas across the organization.
Okay.
Commissioner Lee?
Hey, thanks. One of the questions I had actually got answered and all that, so that'll simplify things a little bit, but one of the things that I have kind of observed over the last several years is there was kind of a transition from people using nursing homes to assisted living, so forth. I think now we're getting to a point where there's going to be some that can't afford that either. Either one of those options. Are you seeing anything trending as far as more people staying in their homes and more need for the good neighbor and that type of stuff in public health? Yeah.
Yes, we are. We struggle in Crow Wing County to find providers that can go into the home and provide the services that would keep someone safe in their own home as long as they'd want to be there. It's a struggle, but we do consult and we work with the local agencies that provide those services on a regular basis. We're in very close contact with them all the time. The problem that I've heard is finding staff to provide those services at the pay that they can be given, that they can receive. And I don't see that, I can't predict the future, but I don't foresee that getting any better with the rising population in 65 plus.
You touched on for what they can afford to pay. Where is their revenue coming from? Is that state? Is that federal? Is it out of the person's pocket?
For our clients, so someone that was serving one of our clients, one of these 500 some, they're on Medicaid, Medicare, so they are receiving the services and they're not having to pay out of pocket unless they're of the higher income bracket, which, like Debbie said, we've got different layers in there.
all right.
And then they can pay on a sliding fee scale. So it looks
Nursing
different
homes
for
or
each
assisted
person.
living facilities get their revenue sources from a variety of different
Yeah.
places too that we're not privy to from that perspective of it. In most cases, it's going to be private pay, but it could be from a variety of different ways of where it's coming from.
I think it probably comes all from the same sources, just people are perceiving it as it's going to be cheaper to stay in their own home versus the nursing
I don't know
home
that
or-
it's necessarily that it's going to be cheaper to stay in their own home, but there's lack of beds available in some of these facilities. There aren't
Really?
enough facilities for the need to be able to have someone be able to be in a certain area. Depending on the facility, they may have a level of acute care that's necessary before they can even provide a bed for someone. They may need different levels of services that they can offer, and as Gina mentioned, if they can't find the staff, they can't open any more beds available or have any more capacity at their locations either. So I don't know that it's necessarily being looked at as a financial incentive. I think there is a level of comfort that people like to stay in their own home versus having to look at having to go to someplace. And I think, you know, the team is working to try to make that happen for those folks where that is an availability for them to do so. But if there is lack of home health that can come in and assist for people who need the more acute care, those are the ones who are going to get priority for whatever beds are available when someone can no longer stay at their own home. But then there's also not enough beds for the folks who do need that acute level of care because those facilities can't find the staff that they need for that purpose.
Okay, thank you.
And the thing I'll just draw your attention to again, as we monitor caseload sizes, Gina was able to identify we could shift a staff person to another area that has increased workload. And so that's what we try and consistently do, is to shift the staff where the need is. We've done that with a financial work position, shifting to corrections. So it's not something unheard of. That's what we're consistently reviewing the numbers, the data, and seeing where we can shift staff. Woofda, that took an hour. All right. Any other questions for Gina on public health or long-term care?
This is good, though, we're getting edumacated here, so.
Just one question, and it's maybe off the subject a little bit. What is a PCA, personal care attendant?
Yeah, personal care attendant.
How are they paid, or how does that work, or?
Most of them are paid through, and I might want Tammy up here a little bit too for this one, because she deals with a lot of that too with the Min Choices assessment, but they're paid through like the home health agencies. I believe you mentioned a couple that you knew of, Barrows, the different agencies in the community, and that's who we reach out to find these assisted, these paid caregivers to come into the home.
I know I sit on the Central Minnesota Council on Aging, and I know right now we're dealing with some of the same stuff as far as funding, as far as the Meals on Wheels and all that other stuff. Was there components to people staying in their own home?
Yes, exactly.
And the more I sit at those meetings, the more I get deconfused or unconfused or whatever about what's happening. But I don't know how you could draw a map of how all this stuff works together. You know, I mean, it's a very complicated thing, and just like you'd said, depending upon the care this person needs is a different delivery system.
Yes, and I'm extraordinarily lucky to have some very senior care coordinators working in the long-term care division who've been doing this longer than I've been working, some of them, and they do a fabulous job.
Yeah, no, thank you.
I'll just add one thing. 65 and older, things change on a daily basis too, so you're constantly reassessing what the needs are of these individuals, so.
Gina, do you, I personally have a problem with, well, I would assume that we all have a problem with fraud, and we can see there's a hell of a lot of fraud going on in this state, and it seemed like a lot of people didn't really care about it, but now that it's been exposed, they seem like they're doing something about it. But I've always wondered about the PCAs, you know, who's checking on them to make sure it isn't somebody that just says, well, I'm taking care of Jenny Jones, and they're really not taking care of Jenny Jones, but they're getting paid. You know, nothing against any, you know, I'm sure there's a lot of people that are doing good work, but I've seen that, you know, I know somebody in town that I said, well, what's your job? I'm a PCA. You know, and he's riding his bicycle all around town, you know. So do you monitor that to make sure that somebody's really doing what they're supposed to be doing?
We have very close relationships with the clients that we serve. Many of our clients who are, they hit 65, maybe they'll stay with us till they're 85.
Yeah.
So they're working with these care coordinators a long time. Their relationships with their care coordinators, that's part of it. They will talk to them about, does your PCA come out? They can see what hours they are receiving for a PCA and then correlate if they're actually coming out there or not. So we're a piece of that, but the home care agencies are also a piece of that.
Okay.
They have a nurse consultant who oversees the hours and the activities that the PCAs provide. So there's a couple layers there, and then there's also the layers in the financial
Sure,
unit too.
a lot of layers.
All right, thank you, Gina. Thank you. Now we'll move to Tammy and the adult services area. I don't know if you want to come up here and sit, Tammy. I don't know how long you're going to be.
Just gonna stand.
That's fine. You tell me when you want me to move.
Or maybe I should come down, I don't know. It's hard, like, you gotta figure out how to go back and forth. Good morning, Tammy Lewick, Adult Services Manager. Yeah, as you can see, we've gone through a lot of programs already, and there's so many to go through. So, in adult services, and we have 74 staff. I have 5 supervisors, 2 in income maintenance or in income eligibility programming, and then 3 in social services. I have about 15 programs, and this is the list of the different programs that we have. So substance use, mental health, housing, disability waivered services, and I noticed our Min Choices is not underneath there, so that's another whole program of how people get to these waivered programs that Gina just talked about for our over 65 and our under 65. Our adult foster care, which is contracted out to Sourcewell, we have approximately 60 adult foster care homes in Crow Wing County, but our supervisor for disability services does oversee or does provide supervision or consultation to our licensor at Sourcewell. We have 60 guardianships, also not up there, but approximately around 60 guardianships. We don't dedicate a staff to that, but that's just another area of services that we are providing in the adult area. Our comprehensive reentry program is the work that we are doing with embedded social workers in the jail. Coordinated community response is the 2 social workers I have working alongside law enforcement in the county. And then in income maintenance, we have adult programming, long-term care, and MNsure. I did want to make just I think go back just a little bit on mandated services that are being paid by the levy. That number did include our county burials, direct care and treatment, those DNMC costs that you are covering, our Minnesota sex offenders that we have at St. Peter and at Moose Lake. So there are other things being paid through the levy dollars that we're mandated to pay for, acute hospitalizations, guardianships. So just wanted to make note of that. Many of the programs that are in my area are state supervised and county administered. You are the local mental health authority. And so these are things that we are mandated to do, and not all of them have the ability for us to claim, kind of similar to what we talked about a little bit in public health. All right, so we'll go into some of my program areas, unless there's questions.
I just got a question. You said, you mentioned the guardianship. Can you just drill down a little more? So if somebody, single person, and they never had any kids, and they get old and they are having trouble paying their bills, is that what this or what do you mean
Potentially,
by
there could be a petition for a conservator if maybe they aren't paying their bills, or, it's affecting their placement potentially. It could also be up on a guardianship. These are all public guardianships and conservators, so they're the ones that are identified as people that are on benefits, county benefits, and do not have any other family member, friend, or anyone else that would take on that responsibility. All right. So, that's interesting how it moves. Does that actually move when you click on it?
What do you want me to do?
Up on the top where it says staff, does it actually go anywhere? Oh, it doesn't really matter. I'll just go through it, but it appeared I was missing some programs, so that's why I was curious.
Did it?
So if you go back, can you go back up?
Okay, there we go. That's how mine starts. Okay, so in the adult financial worker area, you can see our cases. Kind of what Gina talked about, you're going to see some caseloads that have looked like they've gone down. And a lot of that is because of the unwinding. So people were allowed to be on programs, not provide verifications, and so we have seen some decreases. And yet it's kind of coming back up a little as people are providing those proofs. But you do see that in that program area, and you'll also see it in my long-term care financial work and in healthcare financial. Those numbers have come down.
So a question on this then. So of the 10,725, is anybody duplicated? I mean, it seems like, you know.
Yes, they for sure could be duplicated, because like we talked about earlier, a financial worker could be doing the eligibility for somebody, and then they move, through that eligibility, they're able to get onto waivered services, and then they'd be provided a social worker to manage their waiver. We also are required to do the Min Choices assessment. So, I mean, I can give you an example. So a person calls, they are meeting either kind of, or at least they have requested a Min Choices assessment, which is what helps them get onto waiver. They have to work with both our eligibility team to determine eligibility from a fiscal standpoint for the waiver, and then they have to do a Min Choices assessment to determine need. And then once they've gone through that assessment, if we determine that they are waiver eligible and they go on one of our waivered programs, whether that's our under 65 waivers or the over 65 waivers that Gina talked about, then they would be assigned an ongoing care coordinator or case manager. So yes, they for surely could be touched more than once.
Right, no, that wasn't my question. I understand that, but what I'm saying is this 10,725, is that, let's say, could it be there's 8,000 people, but you're counting them twice, or you're counting them more than once? Or is there actually 10,000 individuals?
I'm following you. I don't even know if I'd look at the total, really, because as you can see in this, with each type, I put whether it was an average caseload or whether it was total cases. And yes, that 10,000 could include people that were duplicated.
Because, Commissioner, we have them broken out in this table. So, for example, we have an adult financial worker caseload. As you can see, in 2025, it's about 1,700. So that's one pool of people, right? They're not duplicated. Those are single individuals that are on the caseload. But then if you look at adult protection intake and assessment, where we have 628 cases, one of the people in the financial work pool could also be in the adult protection pool. And because financial workers can't do adult protection and vice versa, they would be counted in that. What I will tell you though, Commissioners, and I'm disappointed that we don't have it up yet, but we're working on, is technology that does show an individual case and which case or which workers are working with those cases. Several years ago, I did provide our top 20 list of clientele that showed the amount of time we're spending with each individual, who's working with that individual. That helped us to streamline services and reduce duplication. We don't have that system anymore. I don't remember why, Jeff could tell us, but we're working on implementing it through our BI, which is what we're presenting to you today. And so I'll have more of that information as soon as that's back up and running. So we are paying attention to that, but because the staff do different work in the different areas, we do count the same individuals in different areas as part of the caseloads, because we have to work with them.
But where my point is, you know, as you give your presentation, we have to trust. But I think of Ronald Reagan said, trust but verify. And I'm trying to verify, I'm trying to ask questions so I can understand things. And I think back to the meeting that you came and presented your long-range plan for staff, which was adding a whole lot of staff, which I don't know that I'm too excited about. And so what I'm trying to drill down is your trend going up Or are you counting people twice, or how many people are actually that you're not counting twice? Is it 9,000 people, or is it actually 10,725? Do you understand what I'm getting at?
How many people have only one service that they get from you? How, would you say, how many of your clients you only touch one time?
We only touch one time. That would probably be in our intake and assessment or child protection intake, potentially, if we just have a report and we go knock and say, oh, everything looks good here, and.
But the
we move
majority of
on.
the folks that you are serving are going to be in multiple categories in here. This 10,000 might be 5,000 people, might be 8,000 people, but the complexity of the cases grows. Right, and it might be 10,000. It is difficult to say because of the fact that they are multiple services that are being provided from different areas. Unfortunately, we can't just say one person counts as one case count,
Right.
because they do hit different services, different systems, different areas, and adds to that burden. And in most cases, the cases are complex enough that they are hitting multiple different areas.
And we
Well,
could drill down to that.
Yeah, I think
Commissioner.
we
We could
I guess
get
I'm
there.
just trying to figure out that, you know, if we go with your plan, which was like 12 or 15 more people, of hiring more people, when I'm out and about and somebody confronts me about that, my job is to explain to them why I'm doing what I'm doing here, and that's just what I'm trying to rationalize this in my mind, so.
I think, I'll just add, from my perception is that you have one case that walks in, you have an application or whatever, but it gets touched by 8 people in the process. So if I had to say to somebody out in a restaurant, we have to hire 8 people because of the requirements that it takes to get.
I understand
to-
that, Steve,
to
but I
resolve
want to
this
know
case.
what I want to know the true number if it's 10,725. It doesn't matter to me if they've been touched 8 different times. I just want to know how many people are being served there. I mean, if you had a turnstile and everybody had to come through that door, how many people are coming in there?
Unduplicated.
But so you just want a gross number of actual applicants or whatever you
bodies.
call it.
Right.
For the organization.
That's all I
But
was-
that doesn't tell you the complexity.
No, I understand the complexity.
Yeah,
And it gets
If I-
tricky, right.
If I have to justify my job, how many of those do I touch? The same thing
And
for
that
you. If you can't, if we can't put a number on, we only go by that gross number, you might not have a job because even though you touch every one of those 10,000 cases, it looks like you're not doing anything when you're actually working your tail off.
And it could get tricky too, because we have families who are on our eligibility cases, so there could be one family unit with 5 people in it. So, and not all of those 5 people would necessarily be eligible for SNAP, but they would be getting health care or vice versa. And so it gets really tricky. We could figure out how to break that down, and it's tricky.
Yeah, the list that I provided, or the list that we've been looking at, or that we're looking at right now, I just want to make it really clear, like this
know
is based more on function and role than it is based on like, you know, individual counts. So, I'm even just trying to look at it, give you an example. So under adult protection, intake and assessment, you're going to see higher numbers in intake and assessment because that's actual call-ins, right? So people that called in an adult protection report, and we do touch it because we have to, you know, call out, talk to that reporter, find out what they're reporting, determine whether or not this is an adult protection screen in or screen out. But then you can see the ones that actually led to investigations and assessments. The average cases are right around 37. So we're running, where we actually screen a case in, we run at about 40 cases kind of at any given time. So I apologize if maybe this report makes it seem somewhat confusing, and the total maybe makes it also seem like that's individual people. But I think to Chair Barrow's comment, there are several functions that we're doing with these individuals. Min-Choices assessment would be another one. We do right around, it's 1,336 intakes, but we're conducting 1,200 Min Choices assessments. So some of those individuals are not being assessed. Majority are, but those would be actually duplicated as well. So I do think we could get you an unduplicated number in these program areas, or we could attempt to try to do that. But I just want to make it clear that some of these definitely would be people that are being touched multiple times by different staff doing different functions for the programs that are being requested.
Throughout the whole table. But individual lines are not duplicated people.
If each one was touched 8 times, like Steve said, and there's 10,725, that would only be 1,340 people.
We know that's not the case.
No, but
I would
I
also
mean,
say,
if
if we're touching one application when it comes in 8 times, that's not okay either. So I think so let's just use a combined application form, McCAF. So when someone comes in to apply for SNAP or healthcare eligibility or cash assistance, they first see, they can apply online, number one, or they can come in and fill it out. They first talk to our support staff person, and then they go to a financial worker. So that's 2. Now, if they have mental health issues that are identified and they say, I got some mental health issues, I want to talk to a social worker, then we connect them with the intake team for social workers, and so that'd be 3. And if we find that their mental health is significant enough that they need ongoing assistance, then they would be transferred to an ongoing mental health caseworker, so that'd be 4. Now, let's say that they have a little baby too, and they're income eligible to get WIC services, then they would connect with someone in WIC, that would be 5. And let's also say that, oh geez, the other kid in the home we think is being abused, so they're gonna need to work with the child protection social worker, that would be 6. We cannot, based on program requirements and responsibilities, have that one financial worker follow that person through all of those other needs. A financial worker cannot work in SSIS or the social work system because they don't have the degree or the eligibility to let them work in that system. Just like our social workers cannot work in our financial work system in Maxis or METS or MMIS, which I know the commissioners that were at the AMC conference you heard about. Our social workers can't work in that system and update program information because they're not financial workers, and DHS will not allow them to go in and make changes. So we're bound to rules, regulations, and systems as they are outlined by the feds and the state in which we have to work. And we've tried to coordinate all of those services as best we can by pulling our teams together around the people, but we're still bound to those rules and regulations and systems that we have to work in. So we might have a case that's touched by 8 different people. It's not at the initial application process, but as they work through the system, there might be someone that's working with a lot of folks.
Well, if they're touched 6 times, like you just said, that's 1,787. So your 10,000 people are significantly less than 10,000 people.
I can guarantee you that we have far more clients than 1,700. I can say that with 100%
I would agree
certainty.
with that, but it's a far less than the 10,000 that you have listed
So-
here.
Yeah. And the 10,000 is not a number, I mean, if you look to the type, some of these are averages and then some are total. And so I guess I would just draw your attention to total intakes. Averages are like, what is the average caseload run? I would have to put total cases in for the whole year instead of the averages and in these different columns. So
Please disregard that 10,000 number.
Yeah.
Kara will work to provide a number of what the number of bodies. The other thing to keep in mind is this is only in the adult care area. This is not all of community services. When you look at this chart that's right here, this is not all the clients that are being served by community services. This is in Tammy's area of responsibility.
Right. Gina had her public health cases numbers in long-term care. Those are under Gina specifically. I would just say too that the average caseload, it's really difficult for us to define a caseload oftentimes for our social workers because they work so closely together, like a mental health case, for example. If we have a social worker working in Gina's team on long-term care that has significant mental health issues, that social worker may then work with a mental health social worker on Tammy's side of the world, because they are much better versed in the mental health resources and information that this social worker might need. So we rely on each other cross caseloads quite a lot as well.
Is there anyone that's ever just touched one time?
Possibly.
Probably.
Yeah.
Well, so using our CAF, our combined application, for example, they'd be touched 2 times, right? Which sounds really inappropriate. We know what we mean, right? So they would see support staff first, get into the system, get scheduled for an appointment, see a financial worker. The financial worker would say, yep or nope, you're not eligible, and then that would be the end of that. MnChoice's assessment. If we did an assessment and they weren't eligible for services, that could be the only time that we would see them. We're required to process those applications. Whoever walks into our door or says, I want a MnChoice's assessment, we have to provide that, but they may not be eligible for our programs, so they wouldn't continue in our service. Tammy, you want to keep going?
Yep. So on the bottom, we have the overtime. As I had mentioned earlier, you can see the high overtime here was in our IMU area, which was a part of unwinding, and then adult services. And adult services would primarily be in our MnChoice's assessments. I've come here before and talked to you about us being behind on our 20-day wait time. We're right around 45 days on that wait time for an assessment. Somewhat in our adult protection area too, because that's been an area where we've seen a pretty high increase in the number of reports that have been coming in and the screen-ins as well. And that in 2024, you can see that IMU went down, and from where it was in 23, again, adult services being kind of that same, an area that was high. I should also mention in 2023, adult mental health had staff turnover, so sometimes you're going to see some overtime when we've had staff turnover and needed to rehire, or we've had people out on medical leaves, and maybe been able to offer some overtime to stay caught up on our cases. And then in 2025, primarily our overtime has been in MnChoice's and adult protection. And you can see that in adult services, a little bit in our IMU area. This past year, I initially had requested a staff person in MnChoice's for assessments. And you can go to that MnChoice's one. Maybe we don't have to either, but there you can kind of see. One of the issues that's been going on a little bit also with MnChoice's assessments is that, so we have that 20-day timeline that we need to complete the assessment. Our request for these assessments has been going up. And then we've had a change, so we went from the original MnChoice's assessment, they revised it, saying it was going to be easier, but that revision takes time for our staff to learn and be trained on, and so it actually took us longer. We're still hopeful that we'll be able to, we do feel that since we've been in that revise now for a period of time, we will be able to start to get a little faster at it. And then long-term care did provide 1 FT, so that was taken off of the 2026 budget because we moved a staff internally to MnChoice's. The other request that we had made was in our adult financial worker position. That was also removed, partly just because of all the changes that are going on at the federal level with SNAP, and we have a lot of unknowns, and so at this time, we decided to take that off, even though that's an area that we've been a month out or longer. We're trying to do some internal strategies to try to just stay up on our being less than a month out on being able to process those eligibility applications. And then the last area was the one that's still on is early engagement services, which is funded through our adult mental health initiative. And I know there was, we mentioned that one earlier. And this is a position that would be funded through our adult mental health initiative. Early engagement services is in statute, but it is not required by counties. The initiative has tried to contract this position out at a kind of a regional level. We've been unsuccessful in putting a contract together. The reason that we'd like to continue this position, or would like to start this position, I shouldn't say continue, start this position in 2026, is that we are seeing more and more where We've had a reduction in pre-screenings for commitment at local hospitals, but we are seeing a request, an uptick in those that are incarcerated and/or out in the community that bounce between the hospital and community with psychiatric symptoms such as hallucinations, mania, delusional thoughts. They're unable to attain their basic needs, and they have a history of not adhering to their treatment plan. The goal of the program would be to avoid commitments and enable individuals to voluntarily engage in needed treatment. So the work of this staff person is to really work over a 90-day time period with trying to engage this person in services locally at the community level. As you are quite aware, we have less beds available to us at the state or even within local hospitals for psychiatric beds. And so it's just, we have a lot of people out in the community that are really struggling with their mental health symptoms, and this position would really focus in on those individuals. We do have our law enforcement liaison social workers that are out there in the community, and we also have our jail social workers that are doing a great job trying to work with these individuals. But with law enforcement, our social workers really can't continue to spend 90 days on an individual out in the community. They really need to move on to the next person that law enforcement is going out and responding to in the community. So they many times identify these individuals, but providing that kind of intensive case management to these individuals can be relatively difficult for these law enforcement social workers. Why is this important? As you know, state-operated services is costing our county right around $700,000 annually. Our acute hospitalizations is in that $40,000 area. And as I indicated earlier, we have seen a reduction in those beds that are available to us. And so we have to come up with community solutions. Even our hospitals have been less, we've been seeing a reduction in them even putting people on 72-hour holds. So we are getting a lot of community calls where somebody is like, this person is not doing well in the community, and they'll be taken to an emergency department. They won't be placed on a hold. They'll return to community. And these are the individuals that our law enforcement staff, as well as this staff person, would be working with in the community. And so that's the position that I have on the current 2026 budget, and would be fully funded through the Adult Mental Health Initiative. This also has to be approved by the Adult Mental Health Initiative. That will be finalized in December. And so if that is not approved, we wouldn't be moving forward with this position. So far, the response from our Region 5 partners has been that they'd like to see us try to move this forward in our region. But, the board meeting will be in December, so we'll know then whether or not they will agree and approve this position. Questions?
Want to go to disability services next, or Minchuk?
Nope. No, well, not unless people want to see any of that. It's not, you can show it if you want. I feel like I've kind of reviewed these. This is,
Comprehensive reentry?
this is comprehensive reentry. So this is just speaking to the work we're doing in the jail. You can see our bookings versus the inmates that we were able to meet with. It's right around 60 to 70% of the individuals that come into the jail take into account that we don't meet with everyone we don't meet with people that aren't from our county. Some of that may change as we have some of the DOC individuals in the jail, but primarily they're Crow Wing County individuals that our team is meeting with, and then doing the screenings. And then sometimes people just get released before we can see them at the jail as well. Some people decline seeing us, so they have an option. They don't have to. And so this speaks to, and then you can see at the top just kind of what some of the, when we screen, what the areas of need are. So mental health, substance use, and then adult services general tends to be things like they lost their driver's license, they don't have housing, they can't return to the home that they maybe were in, maybe there's been a domestic violence situation. So things like that would be just general adult services.
So, Mr. Chair,
Go ahead, Commissioner Lee.
can you back up to that one? So these numbers are decreasing over the last 3 years. Is that because there's been success, or is that because we're not able to reach everybody in the jail?
So 2023 was the 1,500 that we screened. 2024 was 1,225. We've had some staffing changes in here, so that's probably speaks a little bit to some of that work. And then this year, 2025 was only through June. So
We'll probably be around
But
that
it's still
$1,000.
a little bit less than,
mark, but-
yep.
Yep.
And we've had some staff changes there, so some of our processes have maybe changed some too. Like I said, people don't have to meet with us. They have a right not to. We do attempt to screen most individuals within 24 hours of coming into the jail. And
Okay.
so that would maybe speak to what's happening there.
And the min choices?
Sure. Min choices, as I kind of mentioned, we're over our 20-day timeline with the state. We've been in that 45 or plus days for people to get their assessments. I spoke a little bit about they've changed the actual assessment. Hopefully, legislatively, there are some changes coming where people could waive. They could basically say that there is no significant changes, and we still have to make contact with them, but we don't have to go and do the full assessment. That might be a savings for us in '26, so we're hoping with the additional staff and then those changes legislatively that maybe we'll get back to our 20-day, being able to meet our 20-day state requirement on the completion of those assessments.
Is there a penalty for not meeting that?
Not yet. Yeah.
Haven't
Maybe the penalty, one of the things that's really hard is that, like, right now, for the team, for the individuals, we have to figure out who do we expedite. Typically, we're looking at, people that are sitting in hospitals that have an identified placement. So, if you're sitting in a hospital and you know that you can go to this assisted living, or you could return home with these services, we have to come get your assessment done before you can get those things in place. So I would say the penalty is to the individuals that we're serving and potentially to some of our providers as well. It's also really hard on our staff. Going out and meeting with somebody when, it's supposed to be a 20-day timeline and now we're getting out there at 40 days. And like, why haven't you been here? Why did, so that's really hard on the staff at times. These are people, so just remember, these are individuals that meet nursing home or hospital level of care that we're evaluating for. So these are very high needs individuals waiting for disability services or disability waivers.
All right. Thanks, Tammy.
Yep, thank you. Any questions? Sorry, any final questions? Okay, thank you.
All right, fraud collections and support and technology. I did not put that in your title, sir.
That's okay. My legs been sitting for a long time, so. Good morning.
Good morning, Jeff.
Thank you, everybody. Jeff Moingen. I am Operations Manager, Community Services, as this is fraud, collections, claims, supports, and technology as well. You can go to the numbers if you would like. I am also providing services to the community. A little bit differently than my peers as well. Everybody does such amazing work. What we are focusing on are following our dollars, following our money. What you'll see in these graphs, two main sections. The section on the left is the claims or the savings and the revenue. Cases on the right the section on the right is just the cases. So if we just want to look at the main numbers right now, our fraud referrals are the blue. In 2023, we had 410, then 369 in 24, and then 25 is 408. Keep in mind, this is state fiscal year, so those are already accurate numbers for 25. Those numbers are fairly steady. If you're looking at going back to the savings, if you're looking at the first numbers, the darker blue, so in 2023, we had a fraud cost savings of $610,000. 24 is 811, and 25 was 1.1, almost 1.2 million dollars. So what this is telling us, this is a cost savings measurement. So this measurement is an individual that was identified as having fraudulent activity, and those services were stopped, creating a cost savings. So if Aunt Jenny, we'll say, was using medical assistance or was on food support and was not truthful, had created fraud, will stop their services, and then it'll measure out the following, or the preceding 12 months. So that's the savings to the taxpayer that we're not paying out. So in this last year, we've done over almost $1.2 million in saving taxpayer funds.
So saving, not recovery.
That's
I mean, you're
correct.
not grandma or
Yep.
Aunt Jenny.
Yep.
Not going to try to go after her. Do you go after? Oh, you're getting to that. Okay.
You betcha. Yep, we still will. That's just the savings number. So where your money comes back in is our overpayments. And so that's our claims. So in most of these cases, all of these cases, when there's fraud identified, there's an overpayment. So it's the budgetary piece of that fraud. So if Aunt Jenny uses, for 12 months, she's used cash support or food support that she wasn't entitled to, and she used it for 12 months, we'll calculate, our claims individual will calculate the dollars that weren't supposed to go to that individual, that they weren't entitled to. And that'll be an overpayment assessed to that person that they will pay back. And the overpayment numbers are the cases on the right-hand side are, I don't even know what that's, dark blue. So 157, or no, excuse me. Yeah, 157, 191, and 85. Those are the case numbers. And the dollar amounts set up, those are identified, is the middle section on the left-hand established claims, 332, 138, and 132. You will see a large drop in 2024, where the state had put a pause on our collection of medical assistance overpayments. So we were not able to collect anything regarding insurance, medical assistance. So through the county attorney, we wrote off a little over $800,000 in overpayment debt, or overpayment that was due back. Now, as of July in 2025, they have put an unpause on that regulation so that we can now start being more creative in our collections with medical assistance. So that is going to increase that number again going forward.
What was the reason for the pause?
The legislature.
Legislation, yeah. Yep.
And then of this, the money that's collected, what percentage can the county keep, and then what do you have to pay back?
Yep, so of the overpayments, we are able to keep a smaller percentage of those, and it's dependent on the program. What the bigger number that you're probably looking for is in our estate recovery. So, and that's the last numbers that we'll go through. There was 238 cases of estate recovery in 23, 268 in 24, and so far as 156 in 25. These dollar amounts are recovered. This is revenue coming straight back to us. In 23, there's 141,000, 143 in 24, and 25 so far. This is again this is not state fiscal year. This is our calendar year. We've received 110,000. So again, those are dependent on program of how much we recover. These numbers up here are our revenue numbers. Collected is, so we typically hold on to 25%. That's an average. That can ebb and flow a little bit. So these are numbers that we're maintaining. So we're collecting, $800 to $1 million in estate recovery.
So of the
As a county.
of the percentage that the county here get to keep,
Yep.
do you think that amount covers your wages and whoever the other staff is it kind of a wash, or, and I think of Mary Cope asking questions. She said, let me be the devil's advocate. So if we're not, if it's costing us money to go after the fraud, you know, to have levy dollars, then why are we even going after the fraud?
Yep. So fraud.
Do you understand what I'm saying?
Yeah, absolutely. Yep.
I mean,
So fraud is a not levy dollars. Our fraud investigator is paid for by a grant.
of course.
Yep. through DHS. So this last year, our cost-saving numbers have been such that we qualify for an additional fraud investigator. So that is what we applied for. And that's one of the positions that we're going to be asking for, is a funded fraud investigator, changing from 1 to 2 fraud investigators now.
So does that mean we're doing too good of a job? We're uncovering a lot of
Yes, sir.
fraudulent activity, and then that they give us more money to go after more.
Continue to be more aggressive, and we have we will, if approved, we will have a means to be more aggressive. There are a lot of cases that we're behind on. There's a lot of potential cases out there that we can do a lot more with another individual.
Jeff?
As far as the sorry.
No, you keep finish your
As far as
conversation.
the levy dollars, our collections officer is paid for by the levy. Those recovery dollar amounts are substantially higher than the salary. And there are ways that we can be more aggressive as well in those collections. We want to be careful in how we address those. Specifically, we don't want to work in a way that we're harming individuals or families that are putting them into other services that are going to cost taxpayers money as well. If that makes sense.
Yeah, it does. If somebody's flagged and it's proven that they've engaged in fraudulent and screwed the taxpayers, are they put on a list where where 10 years from now they come in and they go, oh, I need some help? Does it get flagged?
Yeah. Yep.
Then,
So
we say no go.
In many cases, yes. So in many cases, depending on the severity of the fraud and the intentionality of it, we will go and disqualify these individuals from services that they've received. And the first disqualification is a year. Second disqualification is 2 years, I believe, and then it's lifetime. So there is definitely a reason that, and some of these situations are an individual that is, maybe made a mistake on a form or forgot about, didn't know they had to report a checking account with their adult child or something to that respect, where it was an honest mistake. But some are quite abrasive fraud situations that we want to uncover, and we want to hold these individuals accountable.
Yep. That was the question I was going to ask, is all fraud intentional?
No.
All fraud what?
Intentional.
Oh.
Where somebody is literally putting something down, I know I can put this down here and I'm going to try to get some money.
Yes, sir.
Is all fraud intentional? So when you say fraud,
Yep.
I'm assuming that it would be all intentional, but it isn't all intentional.
That's correct. So our cases are investigative cases. So they're cases that come up and say, is this fraud? Is this not fraud? So that's what we're sourcing off of. The cost savings are not necessarily all fraud, but it's a program still stopped due to a fraud referral. Yep.
Jeff, where are the fraud referrals coming from?
The fraud referrals, the majority of fraud referrals come from our wonderful team. Can we go back there too?
Do they get a commission for that then, or bonus for that, or?
No, they get a grant.
No,
A grant.
no, and it's financial workers knowing these clients when they come in, just knowing who they are, being able to read what information they're saying, is it consistent from the last time that they met with them? The majority of our fraud referrals come straight from community services, and that is absolutely huge. So many of the conferences that we attend from a state level in the Mafia, it's the Minnesota Fraud Investigators Association. It's so many investigators have trouble meeting the state standard of referrals, and we're just opposite of that. We have amazing staff that notice things and bring them up.
But just so if the people have it coming, we're going to do everything they can to get it. But if there is fraud, we're going to do everything, double down on everything we can to get it back.
Yes, sir.
Well, and just to, you guys have heard about the case that we have with the BCA that we're taking forward. There are a couple of those that we're working with. We also, to your point, I don't remember who asked about the PCA services. We've got a potential fraud case there that we're working with State Attorney General. So we pull out the big guns when we can, when it makes sense. And Jeff's team is doing amazing work. Rochelle Node, who is the the main fraud investigator, although it's all of his team, was former law enforcement. And so she does interviews like nobody's business and is doing a fantastic job in that area. And you can really see that by the numbers. And that's not to say that the other team members aren't doing a fantastic job. They are as well. We know we can do better. And so we have the dollars to be able to bring in another person to support that work. And so that'll be on our 2026 staffing request. We're bringing 3 staff total.
Yeah, we can really do better, and what I mean is not better from a person standpoint, but we can be more aggressive. We can follow the money. That's essentially what we're doing. What the fraud investigator is being more aggressive in is looking at bank accounts, looking at subpoenas, looking at subpoena in bank accounts, rather than taking necessarily, if you feel something's not right, you're not taking people's word for, I don't have a Venmo account, I don't have another account at another bank. We figure that out, and then we can see, yep, you do, and we can follow the money, and if needed, we disqualify that person from those services. So, like everybody here, so many of our jobs are hard. My favorite thing to do in the whole wide world is to make people happy, and sometimes you just don't do it, and it's so hard. So I have the conversation with my fraud investigator and my collections people that when you're onto something, people get upset with you when you find out something, when you ask questions, but you're not making that person happy. But if you're in a boxing ring, or if you're in a ring, and you prove that, you make the whole crowd happy. And that crowd is our taxpayers. And that's where this means a lot, because we're able to save and we're able to do the right thing.
Well, make us happy.
I had asked Jeff and his team, I had the chance to meet with them a couple weeks ago, and we were talking. I said, obviously, fraud investigation, recoveries, all of those things, this is fabulous work, and this is great work, and it's getting known again across the state. Like many of the other things that we talk about, where Crow Wing County is a leader in several areas, this is one of those areas where we have some other folks who are coming and saying, hey, we have this really complex case, can you help us? There is a conversation around, we want to be able to share the knowledge and share the understanding. We also have to take care of what we have here, and if we don't have resources to be able to fully flesh out what we need to do here, unfortunately, we can't go help somebody else at the detriment of our service delivery also. And my question to them is, how do you get the word out that you're not going to get away with it? You talk about accidental fraud versus deliberate fraud. How do you get the word out that we're going to find you if you are committing fraud in Crow Wing County? Because that's how you really see some of those savings come into play, is when we can make all these numbers go down because people aren't trying to defraud because they know they're gonna get caught and they're not gonna get away with it. So there is a little bit of that reputation piece, as they said, that we like to have get out in the community, and people talking to one another and saying, oh, I thought I had this, but yikes, I got caught, now I have to pay it back, whatever it might be. So share, maybe the message is, share the word with everyone you know that we're gonna come for you if you are trying to deliberately defraud in Crow Wing County.
Yeah, very good point.
Mr. Chair, one of the things that I've, just listening to the presentation so far, is how much you guys are a team. That it's a layered effect, that you're communicating across departments. And yours, it's like, I don't know if I want to go see Jeff. No. We need to get Jeff in on this, because when I'm trying to do my job to help people who have it coming, who deserve it or earn it, or we need to take tax dollars to take care of them, it's nice to know that they're getting what they need to get and not getting anything they shouldn't get.
Correct.
And so thank you for sharing that.
Very welcome. Very welcome.
And this isn't to say that support isn't doing amazing work, or technology
Yes, so
coordinators
support,
are
I know,
also
we have more.
absolutely,
doing
our
amazing
support,
work,
and
but-
the support numbers are, again, those are doubled numbers potentially, very potentially, because we're looking at phone calls, and we're looking at client walk-ins, so many times clients are calling, but we're looking at some pretty aggressive numbers, in the hundreds of thousands for phone calls, and we're looking at, right around that 30,000 mark for individuals coming
Those are
through the
actual
door.
people walking through the door.
That's correct,
So those
30,000,
touch points
yep.
where it says sum of support walk-ins through 2025 through June. So in 2023, you had just under 30,000 people who walked through the doors of community services to get help of some kind.
To walk into the little bubble in the front. Yeah, yes, yep, absolutely. Yes, we have a very, very important team, and a lot of this stems from Kara and also April. We would not be able to do our collections jobs very not so good without April's team. So we're very thankful for the smart people in the room. So, any questions at all?
Thank you.
Yeah, thank you.
Oh, did you have a question? Nope.
Nope, not yet.
All right, Family Services, Ms. Griffin.
Good morning, Cara Griffin, Children and Family Services Division Manager. I will start us with, we're going to jump right into income maintenance for the families, the public assistance. I should note, a lot of this information will be repeat. We were here in April at the COW, so much of this was information that was shared with you back then. So our public assistance numbers have leveled off since COVID. This team has not used overtime since August of 2023. We did in 2024 add a shared case aid position. This was to support our family social services and have depth in our supervised visits and tasks. That has been successful. That has allowed our social workers to be able to move on and do social work tasks. In 2025, we assumed responsibility of the Emergency Systems Program. We used to have that administered by SEP. We brought that back in-house. Questions about the financial area? No requests for staff in this area. Child support, this is actually one of those areas that might only have a one touch or one worker. About 90% of our cases are non-public assistance cases. So that would be individuals that are not receiving medical assistance or a cash or child care assistance. So they have sought our services to administer or to help them with having a child support order for a non-custodial parent.
Caro, do those usually come through the courts, or are those individual families who are reaching out to say, can you facilitate this for us?
It would be both. If they're applying for services, they pay a $50. So if they're not on assistance, they pay a fee for our services. But even as they're going through the divorce, the attorneys may reach out to us and ask us to help with the calculation so that they get it correct in the divorce decree. Overtime, do we want to jump to the overtime There we go. Okay, so in 2024, we had an increase of overtime in this team particular. We had a number of staff that were out on FMLA, and we also had staff turnover. That's when we were using then overtime to fill the gaps. In 2024, we also added a shared case aid position to this team. So both of those shared case aid positions we've put in the IMU income area and the child support area because we get a higher reimbursement versus putting the case aid in the social services. So they are required though to be doing child support work, so that the overtime should be going down when we're having turnover or staff out on leave because we do have that shared case aid position to jump in there. In the last 3 years, this team has also experienced a leveling out, so to speak, of their cases. Because back during pandemic, if folks were the higher number of our public assistance cases would mean that we might have more child support cases then for those referrals. So we're now back to a trending level. And then DHS also had some projects where we were expected to close cases if participants were receiving SSI, for example. We were not able to continue to monitor those cases to see if they could pay child support. The team has taken on fiscal tracking from the collections team for out-of-home placement. So families that have kids that have went into out-of-home placement, whether through a CHIPS or through a voluntary placement, this team monitors it very closely to see if we can assess them a parental fee each month, or we can redirect the child support that maybe that non-custodial parent is paying, and then that would offset those out-of-home placement costs that the agency is paying for, which comes right out of the levy. Questions about child support?
So as I went out the door, sorry about that, I thought I heard you say no request for new staff. So no request for new?
No requests for staff in the public assistance area or in the child support area.
Thank you for that.
Then we have the family social services area. These numbers, I mean, this is child protection, children's mental health, adoption, crossover, child welfare, parent support outreach program, child foster care licensing, minor parents, supervised visits, and a number of other programs and services this team provides. Overtime, I don't know if you want to jump to the overtime, back to that chart. In 2023, we had a significant amount of overtime, over 50% turnover in our intake, assessment, and investigations team for child protection. So this area is actually 3 separate teams, 36 social workers, I believe, and 2 case aides. However, the supervisors work very closely to shift staff as we needed. So even in 2023, in 2024, we had to shift some of our children's mental health case managers over to assist with child protection, because obviously child protection is our priority. We're all social workers and we can jump in when the numbers are high. So we had shifted staff across the team. Prior to 2023, or in 2023, we actually had 4 supervisors, and you may recall that I did come and receive approval to change when the supervisor, Rhonda Klein, who retired, we changed that position to social worker, to frontline, because then we could have a higher reimbursement. So that did put a higher administrative burden on the 3 remaining supervisors. However, we reclassified 6 social workers to leads to help with that administrative burden on the supervisors. So helping to manage the caseloads, doing audits, case consults, and then the supervisors can really focus on the performance management and also shifting staff as we need. In 2023, we did add 2 children's mental health case managers, and the shared case aid positions that we added in the other 2 teams have proven to be vital. We've ended up with 100% turnover in our case aids over the last 2 years. So it's good to have some depth there. And we are not requesting staffing in this area in the next years. Questions for the family
Mr.
social
Chair,
services?
Most of your funding, does that all is levy-based, or you also receive monies through the state, through grants, through whatever programs, or how is your program funded?
So the personnel costs, most of it would be through federal, through the Medicaid. We get targeted case management for our face-to-face time with our clients. We also receive some additional aid, such as parent support outreach grant, which that is geared towards our prevention and preservation, so keeping family out of our deep end child protection. The majority of the levy dollars for this area is the out-of-home placement, and that's about $4 million that we have, give or take, that is straight levy.
Do you see your money coming from the feds and stuff as we go into this, I guess, I don't know what's going to happen in the next year or two. Do you see that changing in your department?
In the SNAP, in the public assistance area, we are prepared that there will be some changes coming. We also, though, expect that there will be less individuals that should be eligible or receiving those benefits, so we'll be watching that closely. In the child protection area, you may recall there was a governor's task force that was over 10 years ago. That has continued. There continues to be a lot of attention in the child protection area. There is a act that is going to be coming to Crow Wing County in the next year. Right now, there's counties across the state that are piloting it. We are prepared for that here, and we do not feel that it's going to impact our staffing or need for resources. We feel that we have already built it into our practice and that it will not be a burden on the levy or for Crow Wing County levy dollars.
Mr. Chair and Commissioners, that's something that you hear differently from a lot of your colleagues across the state at AMC last week and in other meetings that you've heard over the last year. The act is causing considerable consternation and concern for many counties across the state in the tune of large dollars that they are expecting is going to increase them. And which is part of the reason I have asked Cara and Kara several times over the past year and a half, are we sure that we aren't going to see the same kind of issues that others are saying they are? And a lot of that is because of the work that we are doing and have been doing. It has prepared us to be in a better position than several of our other colleagues across the state. So when you continue to hear some of your folks saying that this is going to potentially add millions of dollars to their levy in some circumstances, there's the good work that's already been done here is making sure that we are well positioned to address what needs are coming.
Again, we lead. We plan, we lead.
Thank you.
You pointed, Paul, you pointed, that's not polite.
All right, now we'll go to Krista on Community Corrections.
Good morning.
Good morning.
Good morning.
I'm Krista Jones, Community Corrections Manager with Crow Wing County. I will jump right into our different areas in community corrections. First, there is intake. With that position, they do the court order reports. We talked about this a little bit at personnel, the PSIs, the MINPATs, the sentencing guidelines worksheets. So that is currently one staff that handles all of those reports that are ordered by the court. Our interstate and intrastate transfer, that is currently one position as well. And that person handles all of those cases that are transferring between counties as well as between states. Our telephone reporting system, those are low-level or administrative type cases. So those are some of those low-level crimes that have had a risk assessment maybe, and they're considered low risk. They're calling in and reporting in. There is about 30 of those cases that are in violation, and we're just kind of monitoring to see if we're going to move them up depending on their risk level or continue to keep them in the telephone reporting system. Our supervised release area, those are those offenders who are coming out of prison. So also known as parole. In Minnesota, we call it supervised release. We currently have 2 agents as part of our supervised release. We know that those numbers are trending upward and will likely continue to trend upward with the Minnesota Rehabilitation and Reinvestment Act that was passed in 2023 by the legislature, meaning that if those offenders who are in prison qualify for that program, they will now serve only 50% of their time versus 2/3 of their time in prison, and then they will be coming out on supervised release to us. They do have to complete programming in prison as part of that, and there's a lot of requirements to qualify for that program, but we expect those numbers to go up, so we're planning for that. And currently just got 2 additional agents trained within the department to monitor supervised release. It's very different than probation. You aren't reporting directly to our judges and at a local level. There's a hearings and release unit, and you're involved with the state and that unit much more than at a local level with supervised release. And then we have juvenile probation. Currently, we have about 2.5 FTE with our juvenile population. Historically, we always had 3. Our numbers trended downward. So we did shift those resources to other areas within the department that needed that. I will say that we are reassessing that again, just because of the complexity of cases and the needs of our juveniles that we're seeing, extreme mental health needs as well as aggression. So we're looking at how we're going to manage those cases because the numbers that the juvenile agents are carrying right now, it's really difficult when you're dealing with those complex cases and the time it takes to manage them. Our adult probation, really below that is specialty areas within our adult probation unit. So we do separate caseloads because there's additional training, there's additional risk, there's various targeted criminogenic needs that need to be targeted with those populations. So there's our sex-specific unit. That's 2 agents. One is currently probation, and the other is supervised release. However, we are going to cross-train those 2 individuals going forward so that they aren't separate. So both of those agents will now be trained in probation and supervised release, trying to prepare for what we expect to be additional cases in our supervised release area. Our domestic violence, as you all know, we saw a significant increase in that area during and post-COVID. We're fortunate to be able to add that ARPA position, although we're not asking at this time to add any additional positions in community corrections. We were able to reallocate those positions to cover those ARPA positions. And that has made those caseloads much more manageable. We have 4 domestic violence agents right now, and their average caseload vacillates between 45 and 50 right now. Not ideal, but our caseloads have trended downward because of those ARPA positions and those additional allocated positions we were able to get. Our gender-responsive caseload, that is a female-specific caseload where that agent is specifically trained to, in women's issues, in moving on curriculum. That's a cognitive behavioral intervention specific for females. So they have specific training in that regard. And then our drug-specific caseloads, right now, we have 2 agents that just handle drug-specific, more medium and high-risk caseloads, and those run around 50 to 60 on average at this time for clients. Those agents are writing a lot of violations, dealing with a lot of use, doing sanctions conferences, and getting them into treatment, working a lot with Tammy's unit, with our substance use disordered unit, and working closely with those workers as well to get them into treatment as quickly as possible, working with the CRE team in the jail to try to get them directly into treatment from jail so they're not getting that lapse in being somewhere, because often they get out and they start to use again, and then you're just trying to get them sobriety to get them back into treatment. Our DWI, there's a kind of a higher risk DWI. We have one agent that handles those. They're medium to high risk, focused on DWI and now controlled substance, because we're dealing a lot more with marijuana and people driving under the influence, and those cases tend to drag out a bit more than the DWI because we're sending those in for confirmation, and so by the time they come through the court system. Our general violence and property, we also have one agent that's handling those. Those are a little lower level. Not low, those would be on telephone reporting, but medium risk. And our 3 programs that we consider enhanced in our adult area are our Alternatives to Incarceration program. This is a intensive supervision program. Drug offenders who don't meet criteria for our drug court. We do take offenders who do have some violence in their history. Drug court does not. And then our drug court and DUI courts that you all are, I believe, pretty familiar with those programs and funded mostly by grants. Drug court is about 75%, DUI is about 100% funded, so. Any questions on those programs?
I do. Yes?
Mr. Lee,
Okay.
go ahead.
Your parole officers are 2 that you're talking about. What's their caseload?
The supervised release?
Yeah.
On average right now, well, Bobby Town just has 46 right now. Our sex offender, there was about 48, which is why we are training those additional staff so that we can reallocate some of those cases. And our other sex offender agent is going to also take on some of those supervised release cases. And we may shift somebody else into supervised release. Or we may use the 0.5 EBP coordinator position. Our evidence-based practices is also a 0.5 FTE. And originally, she was going to be handling juvenile, but she has been handling some of those cases, learning some, and also she's been handling our transfer caseload that has been vacant since we're hiring for that. That person is starting in 2 weeks.
Okay. And how about your 2.5 FTEs? What are they averaging for a caseload?
In which area?
Your juveniles?
The juveniles are anywhere from 36 to 45, depending on those needs. Like I said, one of our juvenile agents has really specialized in mental health, and she's working really closely with those high needs kids. I believe we talked about a couple of those kids at personnel. At the last personnel meeting, we talked about a couple of those kids in specific situations of those real complex cases. She works really closely with both children's mental health and adult mental health, because as they're aging out, as juveniles, we lose them at 19 no matter what is going on with them. If they're in detention, it doesn't matter. We lose jurisdiction at 19. So really bridging that gap between the juvenile world and the adult world for those severely mentally ill kids is important for continuing their care.
Okay. And how about, just for an average, what's your adult probation ratio?
Depends on which caseload. So if we're looking at the domestic violence cases, like I said, they're anywhere between, right now, average about 46 per agent. Our drug caseloads are...
I think that one you said was 50 to 60.
Yep, they're 59, 57 right now. The medium risk DUI and property are more up in the 80s, 84 and 86 cases. And then obviously our specialty and enhanced courts, they're actually capped by the state at 25.
And what falls into that category?
Drug court, DUI court,
Okay.
Our Alternatives to Incarceration program is actually run by us. Crow Wing County, Wright County, and Anoka County are the only counties that have that program currently. And right now, there's about 22 in the program, but that agent actually helps with some other things as well. Some of those transfer cases, some of those cases that we just need to do an investigation quickly, she will take those on. And I think she has an additional 14 cases right now that she's handling when there's a need.
Krista, the numbers that are on the screen there are those actual bodies? I mean, those are the number of actual people, correct?
Correct.
So in 2023, there were 2,570 people who were on some type of probation supervision.
For that entire year.
For that entire year.
Not, if you, intake is reports. So there could be somebody that has a min pad and a worksheet. You know what I'm saying?
Yes.
Like, yeah. So
Yeah.
intake is reports. All of the rest are actual bodies. They're not cases, they're clients.
So that shows you that's the actual numbers that were in 23, 24, and then for 25, that's through
August 9th.
August 9th.
Perfect, yep. Sorry, I didn't even look at the screen. I was listening to you.
Commissioner Coring?
Oh, is he done?
I guess so.
Okay. Krista, if you look at if you look at corrections now, and then if you go in your time machine and you go back to community corrections, and that poor little gavel up there is missing some wood. Back in the community corrections days when I had to gavel it so hard, a piece of wood flew off of it. Do you think things are better now? Or do you think things were better when we were in community corrections with Aiken and Morrison County?
I feel very blessed now.
You're not mad at me anymore, are you? You were upset.
It was a difficult time.
It was a difficult time.
It was a very difficult
Yes.
time, and I think we've come a long way. You know, I think that probation overall has changed as well, but seeing the support of the county board and being able to come here and talk about it, and you guys willing to learn about what we do, because it is complex. It really is. It isn't just numbers up there. I would love it if any or all of you would come and shadow a probation agent, would come and sit in on our cognitive behavioral groups that we're facilitating. 2 years ago, we were facilitating 2 groups. We're now facilitating 8. And those are domestic violence groups. Those are moral recognition therapy groups for our drug clients. They're decision points groups. We're doing one in the jail as part of their programming over there, their impact program. We've just been able to increase our cognitive behavioral interventions because we know that's what works. There's a time and a place to put somebody in jail, absolutely. But in order to affect long-term behavior change, we have to work with these people. Yeah. We have to build relationships with them. We have to break down their thinking and really how they got where they got, or you're not going to have long-term behavior change. And I feel like we're able to do that much more now effectively because you all have invested in our programs, because we're part of a bigger system that can reallocate a position here to here when the needs are, and that's something that our management is constantly doing, reallocating the limited resources we have, because we do want to spend our money the best way that we can.
Well, I just want to say I'm so proud of you personally. I'm proud of you personally because I can still, well, Rosemary and I are the ones that can think back to when this place was full, and then Paul Teedy upset the law enforcement officers, and so they were all standing in the back there too. And it was some trying times, and when the policymakers who are elected to make these decisions, sometimes they're the right decision, sometimes they're not the right decision, but that's the decision we made, and I think it really turned out good, and from then until now, I'm really proud of the job that you're doing from the times that I've seen you come in and talk to us. I just really happy with what you're doing, so thanks for that. Appreciate it.
Thank you, Commissioner. That truly means a lot to me. And I just do want to say on the record that Commissioner Teedy did hug me on his last day.
Krista, was it a nice hug or was it a bear hug?
Sidearm, but it was a hug.
So I do have a question for you. We know they're going to close one of the state prisons. That's about 1,000 inmates or close to it. Most of them have 900 and some or close to 1,000. And you talk about the length of service that they have to serve now, which is 0.5 rather than 0.75. Are you looking at the trend and how that's going to impact what your probation team is going to be faced with?
We are. You know, the DOC tells us that won't impact us any more than MRA, but as you know,
DOC will
that's all
tell
I
you
need to
anything.
say. But yes, we are watching that as well, which is again why we're really trying to train staff, shift resources, and make sure that if those numbers come, our supervised release unit is capable of handling it.
So I'm looking forward to the conference coming up for MACAC where we'll hear about how DOC will handle the funding of your group and around the state. When they're giving up an awful lot, we'll see if the dollars follow that.
Yes.
But I just want to warn the board that potentially those dollars won't follow it, and we're going to have to absorb that. So these are just things that are coming that are potential pitfalls for us in terms of our levy, so.
That's correct. And at MACAC, we continue to push at the legislature to be fully funded. We are not yet fully funded, although we received huge additional funding in 2023, as you all know. We continue to work hard on getting fully funded, and that won't stop.
On a personal note, I'm glad to see you back here.
Thank you. It's great to be here.
Very nice. Thank you.
Any other questions?
So that wraps up the presentations from all of the team, and I hope during their presentations you heard how we are focused on the key elements that I brought forward in the beginning related to the proven results, our considered risk, our resource management, our staff engagement, as well as our fiscal responsibility. All of those things are priority for us as a team, and we look for your direction. Anything else you want us to continue doing, stop doing, or change what we're doing, we would be more than happy to hear any ideas that you guys have.
Any comments? Commissioner Lee?
Two questions, actually, final questions and a comment. April, going all the way back to the very beginning, I think you had these on the board and I forgot to write them down. What are the total expenses of community services right now?
2024, was it like 48 million-ish, I believe?
Okay. And what is, and this I don't think you had, but I'm hoping you have it off the top of your head, or you can at least get it to me. What is the total amount in benefits that state benefit money that has gone through Crow Wing County in that same time period?
I would have to pull that for you because
Okay, that's fine.
we have
There's
several
lot.
different types of benefits.
Okay.
And if you send that to one, can you send it to all?
Okay. So, Kara, what's your average FTE to supervisor ratio?
Oofda. It depends on the area. So,
Just looking for the average across the board.
well, we have anywhere from about 8 and to about 15.
Okay.
So it depends on the area.
Okay. Okay, and the last thing is just a comment. Kara mentioned it briefly in her presentation, a part of her presentation, but we were just at the AMC conference this last week, and one of the things that was presented in one of the meetings that I went to, speaks to the bottleneck that I'm seeing as we look at this and where some of this is going. The data entry side of things that they're working with is amazing. They're actually still using a DOS system from 1989 to enter this stuff. So they did a presentation where I think it was a part of a training video where they showed a person entering name and address into somebody's file, and it took them 9 minutes to do it because it was, you have to have different coding, you have to have I don't know, 8 or 10 page file sitting next to your computer that says what the codes are unless you don't have it memorized. And then they had on the FaceTime presentation, they had a guy that was doing a full application at an office somewhere in the metro. I don't know where he was, but I think his entire application process, entering one person in, took like 48 minutes, and he did it while the meeting was going on. That is incredibly stupid, in my opinion, and it's something that they're forced to deal with because of it's a state computer system. We have no control over it, and we're forced to use it because that's what the entire state is using. So that helped me to understand a little bit about where we're at with our staffing. And I think that's a bottleneck that we got to figure out how to resolve. And I realize it's a state problem, but I think that's something that we might be able to, because we have been a leader in so many other areas, we might be able to find a way to deal with that and help that. I look back at the Sheriff's Department. When I was there, we actually partnered with a company to integrate computer system from our squad cars to dispatch center. It was called LETG, and we were a startup company that we worked with and built that system. And now that a lot of the state has gone to a system like that based off of what Crow Wing County started, and I think that might be a way that we could find a way to cut some of these costs, because I know that this is where a lot of our expenses are being used, or our levy money is being used is simply on data entry, and that's ridiculous, so.
I feel like we all should stand up and applaud that, guys, but we won't, but just know that.
Sounds like the county board needs to be in charge of the state Crow Wing County Board.
So let's go, I'll vote for that. Should I make a motion then, Paul, or no? I had attended the same thing the year before at that meeting, and I'm just wondering how long are we going to admire the problem before we do something about it? Because it has to be frustrating for your staff to sit there and, oh, you don't know that system? Well, here, I know this system. I've used this one before. It's not streamlined. It's not efficient. And we're mandated to do these services, and it's like you're doing it with your hand behind your back. So thank you for all the work you do.
You heard during that meeting that during the legislative session last year, they did allocate, I'm going to get the number wrong, 30 some million dollars for SSIS modernization. SSIS is only one system. If you recall the chart they showed on the screen, there are 6 systems that these folks are required to use on a regular basis.
And that's just in social services?
That's just in social services aspect of it. So add to that all the other systems that are being utilized. Those 6 systems, the newest one was implemented or introduced in 2004, I think it was at that point. And these are all band-aided issues that are just being barely the surface scratched. The $33 million that the legislature has appropriated for this, that's great. That's a step in the right direction. I think everyone who has used any of those systems will tell you that there's not a lot of breath being held thinking there's going to be any modernization that happens in the very near future. Even though there are deadlines that they have put in place, the work groups haven't really move forward with it. And I believe the state still thinks they can build it themselves. And they are not. You heard Representative Torkelson talk about the Minlars disaster. This
was just
is
gonna bring that
lining
up.
itself up to be something similar, which no one wants to see happen. So I appreciate the fact that and we should all appreciate the fact the legislature has heard from counties, from all of you. You all talked about this with your legislators last year. They've heard that this is a concern and an issue. The solution is not going to be automatic and overnight, and I think that they feel like they've done their part because they've put some dollars toward it, so they can wash their hands of it.
Yeah, the Minlars system, you know, when they tried to build it themselves and put it in place, I think they figured it was $100 million they spent on that. And then they went out and got something else off the shelf somewhere else that worked just fine, and that $100 million went away.
Is that it?
I think that's it, unless somebody has something else.
Well, I just noticed that the face of Crow Wing County just showed up in the back of the room. I don't know if he has anything.
He's not on the agenda, though.
Oh, okay.
Thank you for your time. Appreciate coming in front of you today.
Thank you, guys.
I just
for
want
your
to thank
time.
all of you for doing this. This helps me greatly, so appreciate it.
Very much appreciated. Thank you.